हाँ जी ਵੈਲਕਮ ਕਰਦੇ ਹਾਂ ਤੁਹਾਡਾ ਸਾਰਿਆਂ ਦਾ ਨਰਸਿੰਗ ਕਰੀਅਰ ਚੈਨਲ ਦੇ ਉੱਤੇ ਜੋ ਆਪਾਂ ਬਾਬਾ ਫਰੀਦ ਦਾ ਪ੍ਰੀਵੀਅਸ ਐਗਜ਼ਾਮ ਡਿਸਕਸ ਕਰ ਰਹੇ ਹਾਂ ਉਹਦਾ ਥਰਡ ਪਾਰਟ ਹੈ ਇਹ ਸਟਾਰਟ ਕਰਦੇ ਹਾਂ ਫਰਸਟ ਕੁਐਸਚਨ you assess a client who has just returned to the recovery area after undergoing coronary arteriography. Which information is most concerned? So options ne A pedal pulses are palpable at +1, B apical pulses 122 beats per minute and regular, C left groin has a centimeter bruised area, D blood pressure is 144 into 78 mm of Hg. So ਇਹਦਾ ਆਨਸਰ ਕੀ ਹੋਊਗਾ if the apical pulse is 122 beats per minute and regular. So this information is most concerned which is undergoing coronary arteriography. B is the right answer. Second, the nurse is caring for a patient postoperatively who develops sinus tachycardia. Which of the following intervention should the nurse perform? So options ne A apply warmed blankets, B administer atropine sulfate, C position the patient in a left lateral position, manage the patient anxiety. सो फर्स्ट प्रायोरिटी की होगी मैनेज करनी पेशेंट दी एनजाइटी नू मैनेज करना डी इज़ द राइट आंसर थर्ड हैगा द नर्स एडमिनिस्टर विच ऑफ द फॉलोइंग प्रिस्क्राइब्ड ड्रग्स for the purpose of revealing both positive and negative clinical manifestation of schizophrenia. A selective serotonin uptake inhibitor, B dopaminergic, C anxiolytic, D sedatives. So right answer is dopaminergic. B is the correct option. Fourth, the client is experiencing severe diarrhea and serum potassium level is 3.3 MEQ. Which intervention should the nurse implement first? A notify the client doctor, B prepare the administer intravenous potassium, C place the client on cardiac telemetry monitor and assess the client for leg cramps. So right answer होगा place the client on cardiac telemetry monitor. C is the correct option. ਕਾफ़ੀ ਇੰਪੋਰਟੈਂਟ MCQ ਨੇ ਪਿਛਲੇ ਐਗਜ਼ਾਮ ਦੇ ਵਿੱਚ ਇਹ ਸਾਰੇ ਰਿਪੀਟ ਹੋਏ ਨੇ ਸੋ ਸਾਰੇ ਜਣੇ ਵੀਡੀਓ ਨੂੰ ਐਂਡ ਤੱਕ ਜ਼ਰੂਰ ਦੇਖਿਓ ਫਿਫਥ ਹੈਗਾ ਕਲਾਇੰਟ ਡਿਨਾਈਂਗ ਸੁਸਾਈਡਲ ਆਈਡੇਸ਼ਨ ਕਮਸ ਇਨਟੂ ਐਮਰਜੈਂਸੀ ਡਿਪਾਰਟਮੈਂਟ ਕੰਪਲੇਨਿੰਗ ਅਬਾਊਟ ਇਨਸੋਮੀਨਾ ਇਰੀਟੇਬਿਲਿਟੀ ਐਨੋਰੈਕਸੀਆ and depressed mood. So which intervention would the nurse implement first? A request a psychiatric consultation, B place the client on one-to-one observation, C complete a thorough physical assessment including lab test, remove all hazard material from the environment. So right answer की होगा complete thorough physical assessment including all lab test. C is the right answer. Question 6th हैगा the 8-year-old client diagnosed with vaso occulsive sickle cell crisis is complaining of a severe headache. So which intervention should the nurse implement first? Assess the client neurological status, administer a narcotic analgesic via intravenous, administer 6 liters of oxygen via nasal cannula and increase the client intravenous rate. सो केड़ी ऑप्शन इन्हां चों सही होगी ए असैस द क्लाइंट न्यूरोलॉजिकल स्टेटस सो फर्स्ट ते असैस करना क्लाइंट दा न्यूरोलॉजिकल स्टेटस क्वेश्चन 7th हैगा नर्सिंग मे बी डिफाइंड एज द डायग्नोसिस एंड ट्रीटमेंट ऑफ ह्यूमन रिस्पॉन्स टू health and illness. This definition of nursing was given by A. Nightingale, B. American Nurse Association, C. Henderson, D. World Health Organization. So right answer is American Nurses Association. B is the correct option. Next move to the 8th question. The issues that determine non-incident of battery are A. The patient has been given false information about the treatment. B. Patient is judged incompetent to consent to treatment and received improper care. C. Care that patient has refused is forced upon them without court authorization. D, all of the above. So care that the patient has refused is forced up them without court authorization. C is the correct option. Ninth, for a patient who underwent thyroidectomy 2 days ago. So which laboratory value require close monitoring? Potassium level, calcium level, white blood cell count, sodium level. So right answer is calcium level is more laboratory values. Next, 10th, a patient becomes angry and aggressive towards the nurse after speaking on the phone with his mother. So the student nurse recognize which coping mechanism: displacement, transference, projection, substitution. So displacement is the right answer. A is the correct option of question number 10th. 11th, the nurse is assessing the laboratory report of 40-week gestation client. Which of the following values would the nurse accept to find elevated above pre-pregnancy level? Hematocrit, bilirubin, glucose, fibrogen. So fibrogen is the right answer. Next, 12th, the nurse is caring for a newborn with neural tube defect. The best covering for the lesion is moist sterile non-adherent dressing, dry sterile dressing, talfa dressing with antibiotic ointment, and sterile occulsive pressure dressing. So right answer is moist sterile non-adherent dressing is the right answer. 13th, the male client diagnosed with renal calculi is admitted to the medical unit. Which intervention should the nurse implement first? Assess the client pain, request the client to urinate in a urinal, strain the client's urine, increase the client's oral fluid intake. So right answer is assess the client pain assessment. First priority is of the nurse, assess the client pain. A is the correct option. Next, 14th, a nurse is caring for a child with tetralogy of Fallot. So what clinical findings should the nurse accept when assessing this child? A, slow respiration, B, clubbing of fingers, C, subcutaneous hemorrhage, D, decreased red blood cell count. So right answer is clubbing of fingers. B is the correct option. ਸੋ ਇਹ ਕੁਐਸਚਨ ਸੀ ਜਿਹੜੇ ਆਪਾਂ ਅੱਜ ਦੀ ਵੀਡੀਓ ਦੇ ਵਿੱਚ ਕੀਤੇ ਆ ਤੇ ਅਗਲੇ ਕੁਐਸਚਨਸ ਦੇ ਨਾਲ ਮਿਲਦੇ ਆ ਨੈਕਸਟ ਵੀਡੀਓ ਦੇ ਵਿੱਚ। ਓਕੇ, ਥੈਂਕ ਯੂ ਗਾਇਜ਼। ਤੇ ਵੀਡੀਓ ਨੂੰ ਐਂਡ ਤੱਕ ਜ਼ਰੂਰ ਦੇਖਿਓ, ਕਾਫੀ ਇੰਪੋਰਟੈਂਟ MCQ ਨੇ ਆਉਣ ਵਾਲੇ ਬਾਬਾ ਫਰੀਦ ਦੇ ਐਗਜ਼ਾਮ ਦੇ ਲਈ ਕਾਫੀ ਇੰਪੋਰਟੈਂਟ ਨੇ। ਸੋ ਖਤਮ ਕਰਦੇ ਹਾਂ ਇੱਥੇ ਅੱਜ ਦੀ ਵੀਡੀਓ।